What's great about the sling is that there is a minimal amount of discomfort after the procedure. We do prescribe ibuprofen and Tylenol with codeine. Very often patients don't even need to take these medications. Very rarely patients will need stronger medication the night of the procedure, after the procedure, which is Percocet. However, we discourage patients from taking narcotics since this is a very minor, minimally invasive procedure. Pain is very easily managed. I recommend bed rest and ice for the first 48 hours after the sling procedure. After that, patients can begin regular activities as tolerated. The incision in the perineum usually heals very well within 10 to 14 days. A small dressing is applied to the incision in the perineum. Please remove the dressing after the first 24 hours of the procedure. So if the procedure is on a Friday, remove the dressing on Sunday morning. You can begin taking a shower as early as the next 24 hours after the procedure. I like to send patients home with a catheter. It prevents them from having to get up and urinate many times since they will be receiving intravenous antibiotic during the procedure. Please remove the catheter the next day. It's very easy to remove the catheter. You will be provided with instructions on how to remove the catheter. It's actually not very painful. It burns a little bit when the catheter is removed. Again, very easy to remove. Not worth coming to the office to have the catheter removed. All you need is a 10 cc syringe. There is a little valve, same valve as is available in the tire of your car. All you have to do is take the fluid out of the little balloon that keeps the catheter in place, and the catheter will slip right out. The nurses in the recovery room will go over this before your discharge. Also, this will be provided to you, instructions will be provided to you during your preoperative visit in the office. Should you need stronger painkillers such as Percocet or Tylenol with codeine, please avoid constipation by using Colace, 2 tablets in the morning, 2 tablets in the evening, starting on the day of the procedure when you return to your home. You also need to have a little bottle of milk or magnesia just in case you don't have a bowel movement for the first 48 hours. Please avoid major lifting for the first week after the procedure. I allow my patients to start showering 24 hours after the procedure. There are no restrictions as far as movement is concerned. I would avoid riding a bicycle for at least 2 weeks after the procedure. Patients can return to work or to drive on the 3rd day after the procedure. So for example, if I had patients who had the sling procedure on a Friday, they can go back to work on a Monday. Some patients have a little more pain sitting, so they may need to stay home a few more days. Patients that can tolerate sitting can actually start driving as soon as they stop taking the narcotics. Again, you don't want to drive under the influence of medications that can make you drowsy. In general, patients recover quite rapidly after a male sling. Typically, a patient will no longer feel that they've had surgery anywhere from 2 to 3 weeks after the procedure. The most common complications of a male sling are difficulty with urination. Some patients actually complain that they still leak a little bit after a sling. If a patient can't pee, you need to obviously call right away. After the catheter is removed, you need to drink a lot of water because it may take up to 4 to 6 hours before the bladder is full and that you feel like you need to urinate. Do not try to urinate if the bladder is empty. That will only cause you to be concerned and stress. If you have any blood in the urine, please don't hesitate to call.